This is Professor Capron. In this presentation, we're going to be discussing blood pressure regulation. This material can be found in your ATI Fundamentals of Nursing textbook, Chapter 27, or your Taylor's Fundamentals of Nursing textbook, Chapter 26. Let's review some of the foundational concepts of blood pressure. Understanding blood pressure is crucial in nursing as it is a key indicator of cardiovascular health. Blood pressure is the force that blood exerts against the walls of arteries during heartbeats. Imagine your arteries as pipes and blood as the water flowing through them. Blood pressure is the pressure of this water against the pipe's walls. This pressure is essential for moving blood throughout your body, delivering oxygen and nutrients to tissues and organs. Systolic blood pressure, abbreviated SBP, occurs during ventricular systole. This is when your heart's ventricles contract or squeeze to pump blood out into the arteries. Think of systole as the work phase of the heart. When the heart contracts, it pushes blood into the aorta, the main artery from the heart, creating a pressure wave that we measure as the systolic blood pressure. Systolic blood pressure represents the maximum pressure exerted in the arteries. It's the top number in a blood pressure reading. For example, in a blood pressure reading of 120 over 80 millimeters mercury, 120 is the systolic blood pressure. Diastolic blood pressure happens during ventricular diastole. This is the period when the heart relaxes after the contraction. Diastole is the rest phase of the heart. When the heart relaxes, the pressure in the arteries falls. This lower pressure is what we measure as the diastolic blood pressure. Diastolic blood pressure is also abbreviated DBP, and it represents the minimum pressure in the arteries occurring between heartbeats. In our example of 120 over 80 millimeters of mercury, 80 is the diastolic blood pressure. Monitoring blood pressure helps us to assess how effectively the heart pumps blood and how resistant the arteries are to this blood flow. A high blood pressure can indicate that the heart is working too hard to pump blood or that the arteries are too narrow. Low blood pressure might suggest weakened heart pumping or other systemic issues. In summary, blood pressure consisting of systolic and diastolic pressures reflects the dynamic process of the heart's function and the condition of the arteries. Understanding these concepts is essential for identifying and managing cardiovascular health issues. We all know that the heart is involved in measuring our blood pressure, but I'd like to talk to you about the critical role of the kidneys in blood pressure regulation through what is called the renin-angiotensin-aldosterone system, or RAAS. This system is a complex but essential concept in understanding how blood pressure is controlled in the body. The RAAS is a hormonal system that regulates blood pressure and fluid balance in the body. When blood pressure drops, it's the RAAS that kicks into action to bring it back up to normal. The kidneys play a starring role in this system. They're not just about filtering waste, they're also crucial in controlling blood pressure. So, when the kidneys detect a fall in blood pressure, they release an enzyme called renin into the bloodstream. Renin starts a chemical cascade that produces angiotensin II, a powerful vasoconstrictor. Vasoconstriction means narrowing of the blood vessels. This raises blood pressure. This cascade also leads to the production of aldosterone, a hormone that signals the kidneys to retain sodium and water. The retention of sodium and water increases blood volume, which in turn increases blood pressure. The RAAS primarily adjusts blood pressure by two mechanisms: changing the blood volume and altering the resistance in the blood vessels themselves. By retaining more water and sodium, the blood volume increases. More volume means more pressure. Angiotensin II causes blood vessels to narrow, increasing the resistance against which the heart must pump. This also raises blood pressure. Understanding RAAS helps in managing conditions like hypertension and heart failure, where this system can be overactive. Medications that target different aspects of RAS, such as ACE inhibitors or angiotensin II receptor blockers, are commonly used to treat high blood pressure. So remember, RAS, primarily involving the kidneys, is a key regulator of blood pressure. It works by controlling blood volume and the diameter of blood vessels, ensuring our blood pressure stays within a healthy range. You do not need to know all of the fine details of this, just be aware that this exists. When you get to MedSearch 2, we're going to go over this in much greater detail. The next mechanism for maintaining stable blood pressure that we're going to talk about is the baroreceptor reflex. This reflex involves a sophisticated feedback system that helps the body to quickly adjust blood pressure to changing needs. The baroreceptor reflex is an automatic, rapid response system that helps to regulate blood pressure. Imagine it as a built-in pressure sensor system in your body that constantly monitors and adjusts blood pressure to ensure it stays within a healthy range. Baroreceptors are specialized nerve cells that detect changes in blood pressure. They are primarily located in areas: the carotid sinuses, this is near the division of the carotid artery in the neck, and the aortic arch, the top curve of the main artery coming out of the heart. When blood pressure changes, these baroreceptors sense the stretch, or lack thereof, in the artery walls. When blood pressure rises, the arteries get stretched more. This stretching is sensed by the baroreceptors, which then send rapid signals to the brain, particularly the medulla oblongata. Conversely, when blood pressure drops, the decreased stretch on the artery walls triggers the baroreceptors to send different signals to the brain. Upon receiving signals from the baroreceptors, the brain orchestrates a response to stabilize blood pressure. The brain can increase or decrease the heart rate. For high blood pressure, it slows the heart rate. For low blood pressure, it speeds up the heart rate. The brain can also cause blood vessels to either widen, dilate, or narrow, constrict. For high blood pressure, blood vessels will be dilated to decrease the pressure. For low blood pressure, they will then be constricted to help increase the pressure. Understanding the baroreceptor reflex is essential for recognizing how the body naturally maintains blood pressure and for interpreting the effects of certain medications or conditions that alter this reflex. It also explains why changing positions too quickly can cause dizziness, also called orthostatic hypotension, as it takes a moment for the baroreceptors to adjust to the new pressure demands. So remember, the baroreceptor reflex is a key player in blood pressure regulation. Let's focus on the practical skill of measuring blood pressure. This is an essential procedure in clinical practice. We're going to cover correct technique using a sphygmomanometer and a stethoscope, emphasizing the importance of cuff size, placement, and patient preparation. Blood pressure measurement provides critical information about the heart's ability to pump blood and the condition of the vascular system. It's a non-invasive method to monitor cardiovascular health and detect conditions like hypertension or hypotension. A sphygmomanometer is an instrument used for measuring blood pressure, typically consisting of an inflatable cuff and a measuring device. The stethoscope is used to listen to the blood flow sounds, known as Korotkoff sounds, in the arteries. Choosing the correct cuff size is critical. A cuff that's too small can give falsely high readings, while a cuff that's too large can give falsely low readings. The cuff should be placed snugly around the upper arm, with the lower edge about 1 inch above the bend of the elbow. The air tube should line up with the brachial artery on the inner aspect of the arm. The patient should be seated comfortably with their back supported, feet flat on the floor, and arms supported at heart level. This position ensures an accurate reading. It's important for the patient to be relaxed. Advise them to avoid talking during the measurement and to rest quietly for at least 5 minutes before the procedure. Inflate the cuff by squeezing the bulb until the gauge reads about 20 to 30 millimeters mercury higher than the expected systolic pressure. Be aware that in lab, we're going to talk about how you determine where the expected systolic pressure is going to be. Slowly release the valve on the cuff and listen through the stethoscope. The first sound heard, systolic pressure, and the point where the sound disappears, diastolic pressure, are noted. If the first reading is high, wait a few minutes and repeat the measurement. Accurate blood pressure measurement is crucial for diagnosing and managing hypertension and other cardiovascular conditions. Incorrect technique can lead to misdiagnosis or inappropriate treatment. In summary, mastering blood pressure measurement using a sphygmomanometer and stethoscope is a fundamental skill in nursing. Proper cuff size, patient positioning, and technique are key to obtaining accurate and reliable reading. Now let's discuss blood pressure classifications and the risk factors for hypertension. This knowledge is vital for identifying and managing high blood pressure, a common and serious health issue. Blood pressure is categorized based on two readings: systolic, which is the pressure when the heart beats, and diastolic, pressure when the heart rests between beats. Systolic of less than 120 millimeters mercury and diastolic of less than 80 millimeters mercury is considered normal blood pressure. This range is considered healthy and indicates efficient heart function and healthy arteries. We move into prehypertension when the systolic is between 120 to 139 millimeters of mercury, or the diastolic is between 80 to 89 millimeters of mercury. You don't have to have both of them elevated, just one is enough. This is a warning stage indicating a higher risk of developing hypertension. Stage 1 hypertension is when we have the systolic between 140 to 159 millimeters of mercury, or the diastolic is between 90 to 99 millimeters of mercury. This stage suggests the heart and arteries are working harder than normal, increasing health risks. Stage 2 hypertension is when we have the systolic at or above 160 millimeters of mercury, or the diastolic at or above 100 millimeters of mercury. This indicates a severe condition requiring medical intervention. Let's take a look at some of the modifiable risk factors. Modifiable risk factors means things that we can change. So that includes lifestyle choices. A diet rich in salt, a lack of physical activity, and tobacco use directly impact blood pressure. Salt increases fluid retention, raising blood pressure, but exercise helps to strengthen the heart. Obesity, which is when excess body weight increases the strain on the heart and also leads to higher blood pressure. Overuse of alcohol can cause a sustained increase in blood pressure. Chronic stress keeps the body in a heightened state, affecting heart rate and blood vessel constriction. And then certain drugs, including oral contraceptives and decongestants, can also increase blood pressure. Those are things that we can change. Now let's look at the non-modifiable risk factors. Well, age. We can't change that. As we age, blood vessels naturally lose some of their elasticity, leading to increased blood pressure. Ethnicity. Can't change that. Genetic and environmental factors contribute to higher prevalence of hypertension in certain communities, such as African Americans. Family history. Nope, can't change that either. Genetics play a role in the likelihood of developing hypertension. Gender. Hormonal differences in risk exposure contribute to men having higher blood pressure at younger ages, while women tend to have higher blood pressure post-menopause. I understand that we live in a time where gender is considered fluid. However, as a healthcare professional, you do need to know the gender that the patient was born as in order to make these types of predictions, because they do have an impact. Understanding that there are things we can change and things we can't change helps us to have early detection and effective management of hypertension. Lifestyle modifications for those things we can change can significantly reduce the risk and the impact of high blood pressure. Finally, let's look at the complexities of hypotension and hypertension. We're going to focus on potential complications and try to understand the underlying physiological mechanisms. So, hypotension, or low blood pressure, means that the blood isn't exerting enough force against the arterial walls. Normal blood pressure keeps blood flowing to all the parts of the body. But when it drops too low, typically below 90 millimeters of mercury systolic, it can lead to various issues. With lower blood pressure, blood flow to vital organs, including the brain, can be compromised. This can result in symptoms like dizziness and fainting. indicating insufficient blood and oxygen supply to these organs. In extreme cases, hypotension can lead to shock, a critical condition where diminished blood flow leads to a failure of the circulatory system, jeopardizing organ function and potentially leading to life-threatening outcomes. Now let's look at hypertension. Hypertension means pressure in the arteries is consistently too high, usually defined as above 140 to over 90 millimeters of mercury. Over time, this elevated pressure can damage the blood vessels and organs. Chronic high blood pressure can lead to heart diseases like atherosclerosis, which is a hardening and narrowing of the arteries, increasing the risk of heart attacks and strokes. The kidney's delicate blood vessels can be harmed by sustained hypertension, potentially leading to kidney failure. The tiny, fragile blood vessels in the eyes can also suffer from high blood pressure, risking vision impairment or loss. The heart must work hard to pump against higher pressure, which can cause the heart muscle to thicken and become less efficient, potentially leading to heart failure. As nurses, recognizing signs of both hypotension and hypertension is critical. These conditions can be indicators of underlying health issues and can lead to severe complications if not managed properly. Prevention and management, including lifestyle changes and medication adherence, are key in avoiding the serious consequences associated with abnormal blood pressure levels.